Michael, for the introduction, and thank you, Barry, for inviting us to take part in this discussion. My name is Johannes Brundin, and I'm working for the TEAM Foundation. We are located in southern Sweden. We are an NGO. We're helping organizations, private and public, with their sustainability strategies, environmental legislation, and ISO 14001, and so on. And we have one niche, which is sustainable healthcare. We've seen an increasing interest in this field, so we started Nordic Center for Sustainable Healthcare in 2015. And this, I was asked to talk a little bit about sustainability, and we're working with sustainable healthcare. So this is our take on the topic, and also talk about why we should work with it, and also the opportunities that we see. You've probably seen this report from Healthcare Without Harm and Arup. They concluded that 4.4 of all emissions globally comes from healthcare, which is, in comparison, it would be the 5th biggest country in the world. So it has a very big impact globally. And we're talking a lot about our travel habits by flight, and in comparison, that is 3.4 of the total greenhouse gases within EU. So we're talking a lot about flying, but not so much about staying healthy and avoiding getting sick, which is much worse for the environment. And 4.4 is globally, and for UK it's 5.4%. Another way of looking at it is that healthcare puts stress on the environment, and a stressed environment will cause illness, and ill people need healthcare. So this will be a negative spiral. So, of course, it's the best way is to prevent people of getting sick, but when they get sick, they should get the best care possible, but in a sustainable way. And in third option is to look at the environment and work with the environment, not causing illness, but that is very expensive. So how do we work with sustainable healthcare? And we have done this figure to show that you cannot work just within, for example, public healthcare or within the companies or the state. It has to be all these stakeholders involved. So we need private and public healthcare, universities, companies, the state, NGOs, and development and aid. And we also need to put sustainable healthcare as a neutral platform in the middle where everyone can meet. Because if you put it within the public healthcare sector, it will be hard for the companies to collaborate. If you put it within the university, everything will be about research and so on. So we need the public and private healthcare to create the demand. We need the universities to do the research, companies to provide innovations, the state to set up the legislation, and NGO to pinpoint different topics, and also the development side. If we look at sustainable healthcare as an industry, it's also going on a horizontal level, not the vertical traditional silos that we have divided the industries in before. We have, for example, construction. It's not all when we construct hospitals. It's only when we make sustainable hospitals. For example, life science and medtech. It's only life science and medtech with good environmental performance. It's clean tech with applications for healthcare, and regular companies, like if you're making pencils and so on, it's also in furniture, that is also when it's applied in a context of sustainable healthcare. As an example, we can take, if we have an MRI scanner producing waste heat in one end of the hospital, we usually just let the heat out, but maybe in another area of the hospital, we need hot water and heating. So if we can transport the heat from one side of the hospital to another through a ventilation system for a clean tech solution, then we can take care of it. So and that demands also an ICT solution to monitor the systems, and through that you can also collect data, which is good for you can use it for management decisions and understand how the building is performing and so on. So you need to connect all these silos to look at it from a system solution or a holistic perspective to get the best impact. And sustainable healthcare is also the concept has not. It's a new concept, we can say. So there is no coordination in this field. So that's what we try to do here, to connect the research, innovation, home market, and internationalization. You need the research at the universities, innovative companies. You need the hospitals to create the demand, to create the good home market for the companies, and then spread the knowledge and the technology to the rest of the world. And when you create export for companies, you will also create new jobs in the region, and you will also create new tax revenues that goes back to the hospitals. So you can, in this way, create a positive spiral as well. And we, as we heard in the earlier presentations, we are also seen a new paradigm shift within during the pandemic. We are looking. We see that hospitals are looking more into resilient and sustainable healthcare. We cannot buy all the equipment from China. We maybe need also have like single-use items, masks and so on. Maybe we also need a local laundry that we can reuse fabrics and so on. So this do also create new opportunities for the local companies and also the development of the hospital. And what lessons can we learn from the Nordics? So we managed to. This is from the Nordic Council of Ministers. All the Nordic countries have a council, and for the healthcare sector, we managed to get sustainable and innovative hospitals as one of the 4 strongholds. So this shows that the political will and care from the political side that this is something that we should work with, or where we should be the best. And another thing is hospitals at the forefront. This is near Karolinska in Stockholm, but we can say that public procurement is a strong tool. Also innovation procurement. It's also established in the management. So decisions are based on also that sustainability. It's also established within the organization. So we have environmental coordinators working on within the organization, looking at opportunities to improve, and also systems for environmental performance, environmental management systems, collecting statistics and almost everything. Test beds is also a good example where new technologies are allowed to be tested to find new innovative areas. Also, there are environmental reports, or the environmental performance is represented in reports. And then we're also looking at system solutions. So the hospital is not a standalone unit within the city. It's a part of the city. So, and it's quite a big part. It's maybe 12% of GDP in Sweden is healthcare. So it's a pretty big part of the community, so to speak. And by setting demands or creating the demand of maybe district heating and district cooling, that can also be then provided to the rest of the city and create a sustainable city. National recycling programs, regional biogas digestion, wastewater treatment, clean energy, clean water, and clean transportation is all that can come to benefit for the population. So how do we see on international collaboration and spreading of knowledge or sharing knowledge and experiences, best practices? So yeah, during the pandemic, we had to rethink how to get the information out to within our network. So instead of doing study visits that we've done before, we created a report series where we are looking into different topics. So nitrous oxide destruction, lighting, geothermal energy, and ventilation are 4 that we have done last year. And we're also having a webinar when we release the report, and you can see the best practices from Swedish hospitals and also the available technologies that are available today. And another thing that we have a release very soon, it's Grönköping University Hospital. It's a virtual hospital, and we are collecting all the available solutions that are out there today, together with best practices from that are also installed at hospitals today. So you can go in here, look at different topics, and find solutions that are installed and a little bit about how the technology works. So that's also a source of information which is accessible during the pandemic. And we also, when it's possible to meet, we set up conferences. These are from Montreal in Canada. There was 150 people from about 100 different hospital or healthcare institutions come to this seminar. We have done seminars with Yale, and we have been to Israel and many other places as well to collaborate on this topic. And this is our network. We have about 100 organizations. It's now an international network where we have hospitals, companies, and NGOs, and even governmental organizations. So that was a quick run through from our view of sustainable healthcare. And
many thanks.
Thank you.
Many thanks, Johannes. That's a very good overview, and shows us that you from Sweden are, as always, ahead of the bunch. I remember when I worked at the Karolinska Institute many years ago, how things are moving much faster there than they were elsewhere. So thank you very much. That was a very good sort of overview. Now, there's a time for questions. We've got a little bit behind. So looking in the chat, I think, I don't know if there are local or regional health officials who want to elaborate on what we've done, who want to have an opportunity to talk now. Please, is there anybody here who wants to sort of come in from that point of view, or shall I open it up for questions totally, do you think? Do we have any local regional health officials who want to come in first before I open it up to everybody?
Diane Williams want to come in, as is the chief executive of the
Absolutely, yes.
Yeah, but I'm not sure I do actually. I would like to open it up, and I'd like to kick off with a question, if that's all right.
Absolutely. Go ahead.
It's a question to all the presenters. First of all, thank you very much for some really good presentations, some interesting points there. But I think one of the things I was thinking of is, if you were doing your presentations 12 months from now, what aspect of your current presentation do you think would have changed as a result of COVID?
Thanks, Owen, for the question. It's an interesting one. I'll go first if no one.
Please, yes, thank you.
So, sorry, just to be clear, are you referring to 12 months from now in the future, or from 12 months ago?
In the future. So you've all made presentations, but in each of those presentations, whilst you've alluded to COVID, there's clearly, so Alice, if you think about some of the spaces that you were showing, they were clearly not representing the world of COVID and what that impact is going to have moving 12 months forward.
Yeah, okay, thank you. Yeah, I understand now. So we are working on a primary care centre at the moment in Castleford. As I explained before, it's going through a really structured consultation process at the moment. So unfortunately, I can't show any material on it. However, you know, the design of it has been very much, it's very much taken into consideration COVID in terms of the waiting areas and all the entrances, how you enter the building. So it's been future-proofed in that sense. As far as I understand, I'm not the designer on it. It was redesigned due to COVID. So, you know, that's definitely, you know, and it's a health hub, but it's also primary care. And in terms of COVID for acute hospitals, and in terms of inpatients, single beds, and as Richard mentioned, some of the hospitals in Asia have designed for that. So, you know, again, it's something to consider, but definitely future-proofing, maybe lobbies into patient bedrooms and things like that. We had a presentation from White Architecture a few weeks ago that looked at a children's hospital and the designing of the wards there. And every ward bedroom, children's hospital had a small lobby that would help with infection control. So it may be that rooms become lobbied as well, potentially. That's my response.
Yeah, I can continue. I think we see a very big change already, like from New Year somewhere. The fall was very, not much was happening, but now we see that we get more responses from internationally, and there's more going from strategy to action. We need to do something, and we kind of past the what is called, you get freeze when you're approached by a maybe for the pandemic, but then you see that you need to do something. So I think we will see more action within healthcare, and also seeing that healthcare can be a post-COVID engine that drives the economy, creates new jobs, new innovations, and that we can use using public money, developing the healthcare system, creating jobs and innovation companies, and so on.
I think from my side, it would have to be the interoperability, because at the moment, a lot of these things are a desire, they are a concept, a goal that clinicians are wanting to achieve, or that they need. And at the moment, there are various barriers in place because no one company can actually provide the whole solutions. And so there has always been a reluctance in the past because of different ways of working, because of business models, to really come together and to make sure that connectivity and sharing of data actually happens. And as I said at the time, in things like the remote control, this was actually stimulated first of all by the Ebola epidemic, and that's what got the idea moving. But now COVID has happened. That has become even a bigger pressing issue now, and that's where groups of companies have actually come together and worked on a new international standard, an IEEE standard called 11073, to really drive that forward. So I think that effectively interoperability would be the thing that I changed, because rather than talking about various concepts, I would say that these would now be actualities and probably put into practice.
Very good. So does that answer some of your questions, Owen?
Can I judge? Owen and I had a conversation about this prior to this session, Mike, and he's got some very innovative ideas that are consequent to COVID. Perhaps Owen, you could share those with everyone else, because I was very intrigued by some of your plans that would be more prepared for future COVID epidemics and so on.
So thanks, Barry. I think a few things. I mean, first of all, I think Johan's point. I mean, one of the things that we're very focused on at the moment is how we could reduce what we would call care miles. So, in some way, shape or form, whether it's patient transmission, whether it's friends and relatives, whether it's clinical colleagues who are travelling, one of the things we're trying to see is, can we get to a position where the need to travel is at a minimum point? So, for example, seeing the Sicily sort of hospital, the robotics that are being used there, as a trust, we're probably recognised as one of the most digitally advanced in the UK. And so a lot of our effort is, how do we, not only as an acute trust and a community services provider, but how do we work with our wider system colleagues, for example, our local authority colleagues, so that we can use technology to mean that as far as possible, people can stay at home to receive care. Therefore, they don't need to make the travels. Because when we've done our own analysis and on our sustainability plan, and I think that's available publicly if anybody's interested in that, we see so much unnecessary movement of patients, staff, and so on and so forth. And one of the big bounce points we've picked up from the COVID side of life has been really trying to make sure that we don't revert back to a pre-COVID position, which is driven by what I would call presenteeism. So almost this need to get back and be in a physical space, because that kind of justifies your contribution. So we're trying to move away from that kind of scenario. But there is a point where we have to realise also that having patients and colleagues in physical locations can actually be economic stimulants for those patients, or for those populations, So we've got to get that balance right. I think on the interoperability point, and I don't want to hog this because I'm sure the people have comments, on the interoperability point, Richard, I mean, I know that we're one of the few sites, for example, where our EPR vendor has interoperable solutions with other third parties. Yeah. But if I have to tell you what little hair I've got, I've lost it in trying to get various technology providers to move out of the kind of closed system space and thoughts that they have, to move into that interoperable space. It is really, really hard work. And unfortunately, one of the challenges we've got, certainly in England, is there isn't what I would call enough of an intelligent client side to influence the right behaviours from the various suppliers. I could go on, but just to say that, interoperable, I kind of go to sleep with that word. It's really the holy grail around some of this, and it really will affect what the future of care looks like, not just care from a NHS perspective, but also social care, also housing, and so on and so forth. But those are just a few thoughts from me.
Yeah, fully agree.
Very good, very good.
Just to add to that quickly, certainly some of the healthcare centres we're looking at are focusing on telehealth. So, you know, perhaps less consultation rooms and a room where people can have so it's changed the shape of the building, actually. So this has had an impact on the design.
Yep.
And I think you're referring, Owen, to like non-proprietary systems. So, you know, so that hospital doesn't have to buy into one company's product. So that when you're designing the building, you can tag things on in the future so that it's future-proof. So I think that's an issue too, in terms of the digital hospitals.
Yeah, it's about having flexibility, because there is going to be no one supplier out there who will have what I would call a universal solution to not just care, but preventative type activity. So it's not just about when people become ill. It's about, for example, you may have a wearable device right now yourself. Yeah. It's the whole spectrum of stuff. So what you've got to create, as what Richard is alluding to, is you've got to have what I would call, to help those who are less technically savvy, is the kind of Bluetooth equivalent in healthcare, so that, you know, it doesn't really matter what the proprietary device is or which brand you can plug into one universal platform and things can work and information can be exchanged. So that's the kind of feel, Alison.
Yeah. I mean, sometimes they've been, some things have been successful in terms of certain standards. So, you know, within the hospital, we all know that, you know, X-ray images are all sent by DICOM-3 format. And you have, you know, some interoperability with systems using HL7 or the new FIRE standard, but there's still an awful lot of proprietary solutions, which are just an absolute headache. I think the appetite for that is starting to change. So there's organizations like in Germany, an organization called OR.net, which is a group which try to stimulate interoperability for the operating rooms in Germany by bringing people together and helping develop a common international standard. So I think things are, you know, going in the right direction, but there hasn't been an appetite in the past. Sometimes it's, you know, through, you know, businesses, companies, you know, wanting to protect their own solutions and not wanting to open those up to, you know, to get data out from, you know, for third parties. So I'm hoping that will change. I'm hoping, you know, the pandemic will be yet another stimulus towards that. But you're exactly right. You know, it's something you would lose your hair over, you know, just trying to manage all that and the amount of money that it costs. I can't remember how much, there was a quote that I saw in terms of the billions of dollars that they spend on it in the United States alone. It's massive.
So lots of challenges for the future for us. Look forward to more discussion about that. Anybody want to come in on that again, or should we go to what's in chat? Hello, sorry, Barry.
Mike, just quickly before we move off that really important point.
Okay.
Owen seems to be moving towards a sort of chameleon hospital, you know, so it changes. If there's an epidemic on, the whole structure can change to face up to a surge of cases of people who have COVID. And as soon as that tails off, this chameleon hospital adopts change and structure and focus to have a totally different kind of structure. Isn't that the future? Isn't that what Owen's pushing towards?
It's a tremendous flexibility, isn't it? I mean, that's what we need to build in. I think that's what one of the things Owen's touching on.
I want to register a chameleon.
That really is a challenge. It's a really interesting concept.
It goes back to what Richard was saying about colour, doesn't it?
Yeah, but what's really interesting is last summer, I attended a series of debates about how the COVID pandemic had been handled globally. And it had speakers from America, from Sweden, France, Spain, Italy, lots of different countries, and everybody approached it in a different way. Obviously, there's not really been a global approach to the pandemic this time. There's lots of lessons to be learned. But one hospital, obviously in Sweden, seemed to do the best, which is where they transferred their recently built operating theatres into, individual rooms, and then they've managed to turn it back. I don't think they designed it with the intention of doing that, actually. It was just a happy coincidence. But perhaps it's something, we can follow up this meeting and look at how they did that. And if there is any other questions like this, it's not to say that we've got the answers now, but certainly something we can respond to after this. That was it. Thanks.
Very good. Barry, how are we doing for time? Are we all right to go on further, or should we be asking you to wrap things up?
I think we'd start wrap up because we want to keep our hooks on these wonderful speakers. And if we keep them too long, they may be resistant to keep in touch with us. So can I suggest we start doing a wrap up? But I'd like to, I just posted, how do we keep together, keep on exchanging ideas, informing and educating each other, and share, together in the future? And if we can think about that aspect, about future cooperation for good ends, I think it's not a bad way to wind up.
Well, we could use the health and well-being group as a hub, as a sort of focus for that, if you wanted, or it may be that sort of some other forum would be appropriate, or an occasional catch-up webinar like this one.
I think they should be regular. I think we should have a breathing space with this, think about this, share it with many other people because it's being recorded, and then say, what should we focus on the next one?
Yeah. So it's another task for Sustainable Huddersfield.
Hooray!
But hugely important. I mean, the world is changing so rapidly. I look back on my time in hospitals and I see how there's almost an inverse relationship between the size of the hospitals, numbers of beds they had, and the amount they were able to do. When I started, there were thousands of beds and we couldn't do much. Now there's very few beds and we can do an awful lot. And it's the move to keep people out of hospital, to sort of triage and send them home or to wherever else they might be looked after, to reduce the number that need to come in, and then to get those who are in turned round and out as fast as possible has been amazing. And that's very, very good for people in the nation. And it does free up space for people to do more work, more very good work, important work. I don't know whether anybody agrees with that.
No, absolutely.
We all agree with everything Mike says.
I don't know, you don't have to. But we have to challenge and we have to question and we have to sort of be curious about what's happening. It may not be the way we have been done, not necessarily the way we ought to be continuing to do them.
I think Architects for Health probably would be really interested in, assisting this type of debate. And, perhaps we can also have a think about how we can keep the conversation going as well. So we can keep in touch and think of ideas to help.
I think that'd be wonderful. I'm looking forward to going back to Leeds and having a look at the things you've been doing. Most interesting.
Mike, can we one point to our speakers? You may think, I'm sure you don't think we're being parochial, because this is started off as Huddersfield as a sustainable town. And that sounds, it's a pretty limited ambition. But, the reason why we've chosen to do this is because Huddersfield, nearly all the criteria, is a microcosm of the rest of the UK. It's the typical town of Britain, nearly all the criteria. And so we reckon if we can make sustainability work in Huddersfield, why not in 50 towns, 500 towns? You know? And so we are building networks across other towns and cities in the UK. And so it is not a parochial, navel gazing exercise. We believe we can do it in Huddersfield, then we can spread the message to all these other communities, and it's building sustainability from the bottom up.
Absolutely. I mean, it's not a local problem. It's not even a national problem. It's an international, global problem.
Yeah.
And the debate has to go on. And why shouldn't one of the centres of the debate be here?
Another thing that was interesting, so on the first slide I presented that showed the wheel from the WHO's vision, Healthy Cities, I looked into it, and any city can I think register and become a healthy city. And once you start that process, it helps you and guides you into improvements, and it's based on evidence and research. I think there's Sweden, Stockholm is a registered healthy city, and I've noticed that Newcastle have got the emblem along with when I looked online. So I'm not sure if they've registered and they've done the same, but it's an idea to explore.
Yeah, very interesting.
Very good. Yes.
Richard was trying to get it in just now, Mike.
Yeah, I'm sorry. My internet's been fogging in and out, and I've had great difficulty. But yes, somebody wants to chip in. Who wants to chip in? Richard, please do.
Oh, sorry, I wasn't going to. No, I mean, there's some very interesting discussions I just see in the chat there, specifically about the challenges that people are facing with interoperability. And just an interesting one, I think Phil just put there about IT providers selling their solution based on that functionality being built in. And I think that's one of the things that I hope comes out of the pandemic, is that rather than providers develop solutions that they push onto healthcare institutions, that there's actually a pull. So the need is identified from the hospital about what they need, and the providers then the solution providers actually develop solutions which actually meet those needs. So really to listen to the customers, the end users, and to develop those accordingly.
Okay, can we go to Phil Longworth? Phil,
Mike, Johannes has got to leave us. Can we thank him and say goodbye,
yes.
Johannes? Keep in touch.
Yes.
Thank you for giving me the opportunity to take part in this discussion. It's very interesting, and if we can have some make some international collaboration, that's also something that we're looking forward to. I posted a link to a symposium that will take place. It's Yale University is holding it, and it's one session will be with NHS and University College of London. So there is one also a collaboration towards United States, and we will also have one session which is we will talk about Nordic best practices. So that is maybe one thing to move forward.
So many thanks.
Thank you. I have to leave. Thank you. Bye.
Good luck, and we'll keep in touch.
Bye.
Okay.
Bye.
Now, can we go to Phil? Can we go to Phil? Can we go to Phil Longworth? He's been having his hand up for a bit. Phil, are you muted? Is Phil muted? Can we get him in?
He's left a message.
He might have had to
I can't
leave.
hear. Try unplugging.
Phil, he's got his hand up now.
Yes, I think he's muted. Can you unmute yourself? Any luck? No.
Phil,
A little bit. Maybe the
try
volume
pressing
is right
harder.
down. I heard you very faintly.
Is that better?
Yes.
Oh, that's great. Great.
I don't know what was happening there. Pressed a few buttons, made it better. Yeah, I don't particularly want to make a point about interoperability. It was more about the fact that can I disagree with Mike? Is that acceptable?
Of course it is.
Just thinking about the role of the health and well-being group and sustainable Huddersfield, I think that is going to be really important. But I think one of the things that the council is going to be leading on over the next few months is going to be equally important, because we are going to be establishing a climate commission hopefully in July. And so I think in terms of bringing together the wider set of partners to think about what we're doing about tackling the climate emergency across the district and more widely, some of it can usefully sit there, because certainly I think from a council perspective we'll be wanting to drive that as the place where a lot of the discussion happens. And we've already got good collaboration between the council and the NHS partners in terms of some of the practical action that's already being taken, whether that's about electric vehicle charging points, thinking about sort of what we're doing in terms of sourcing energy, etc. But the Climate Commission is going to be really important, we think, to help galvanise some of that action and move it on even faster and even further.
So, is what you're getting at, Phil, that the council would like to lead on that? You've got good links with the NHS. Would there be a place for Sustainable Huddersfield being a part of?
Absolutely.
But taking the lead from the council.
Absolutely, and I'm not sure, and I'm thinking that a couple of the councils are on the call might want to either chip in or. I think the approach, certainly I'm not directly involved in the Climate Commission, but talking to colleagues who are directly involved in setting that up, they're really keen for it not to be a council-owned and completely council-led activity, and would be really keen to get people from the NHS and wider partners involved in the commission as commissioners and taking a very active role in it. So it's very much trying to take that collaborative approach, because as we heard earlier, the health and care sector is a massive contributor to the issue, and therefore a massive set of opportunities for tackling it and reducing our carbon footprint.
Yes, maybe we can have further discussions about that. I mean, the main thing is that it happens, isn't it?
Yeah.
Because the time is now. We can't afford to wait. These things have to happen. And I wouldn't want to be saying who should be doing it. I would just want to be saying that something should be happening.
Yeah.
I seem to be lost again.
Oh, I can hear you, Mike.
Yep.
Oh, sorry.
I think what's really interesting when we look back again, especially to the Generations House in Aarhus, is that's a lot of communication, and I think a lot of hard work went into coordinating all those different services. And I suppose how would we be able to connect all of the different services within Huddersfield so that they could all get together at a workshop, perhaps, and do some real stakeholder engagement, look at the gaps and the holes and what could be improved, what are people's vision for what would their dream service behave like, and I'm not sure how they handled it over there. I am in touch with one of the architects. I was hoping they'd get back to me before this presentation, but unfortunately she didn't. But it'd be interesting to see maybe how they've handled it, or if anyone has any ideas, having a workshop in Huddersfield and just inviting as many people who would be, as many stakeholders as possible, and start to look at individuals and designing around personas. I went in Basel, I attended some really interesting workshops, looked at the future of healthcare, and we were all put into groups. We had 20 minutes to design a prototype with total strangers, but we used this format it's called design thinking. And you look at an individual, you look at their health condition specifically, and you're giving objects to design with. And it was healthcare on wheels. And there's just so many different ways of doing workshops and getting to the real bottom of people's needs and looking for solutions and combining ideas. Really think there's maybe a different way we can approach stakeholder engagement and getting people together.
That's a brilliant idea. And it replicates when we started our journey of making Huddersfield a sustainable town, we took the Sustainable Development Goals and had a question and said, well, we're not going to impose these on anyone. We told people in a big questionnaire, we consulted widely, okay, these are the goals. What ones do you prioritise? What's most interest? What do you think should be the top of the list? That's how we started by consultation. So your idea there is a perfect one because it fits in exactly with that process, drilling down consultation, but on a more focused area. We'll keep you involved in that.
There is a question as to how we reach across all groups working locally so that we can sort of bring people together so that everybody knows what other people are doing. We avoid duplication. We can be focused. I wouldn't want people thinking that we wanted to be the linchpin for everything. I think Sustainable Huddersfield has a very great opportunity to try and meld and bring a lot of things together, but not necessarily take the lead in everything. But I'm not quite sure how we do it. I don't know whether Chris or Barry have ideas about how we might do that.
Well, I think we we started this thing nearly 2 years ago now. Yeah. We've got working groups, and then we got great participation with the university. We got great participation with the health sector. We got great participation from local business. We could extend that and make it even better. But we're there to work with all the partners in order to achieve something significant. So, but sticking to healthcare, I hope that our dialogue that started today is a first step in refining the arguments, bringing more people into the discussion, learning more, because the one difference about this is we have the money to change the hospital structure locally now, and it's a process that is happening now. So in a sense, this is why health is a priority. It's now. We get it better or we get it worse, we get it good or we get it average now. So it's no time to hang around. We have the money. We're about to make significant. This is why the consultation's taking place. So this is the most immediate of all the sustainability challenges we have in our community.
Chris, you were going to speak before, I think.
All I was going to do was actually probably echo in a slightly less eloquent manner just what Barry has said. That I think it's about the time being right now, and also getting that kind of cross participant collaborative approach. So agreeing what we're doing and then taking it forward.
I mean, is there a master plan being developed at the moment for Huddersfield? Excuse me, yes, if there is.
What's the total sum of money we've got to invest? Off the top of your head, anyone? Owen had to go, didn't he? Harriet, what's the total sum of money that I lobbied and other MPs lobbied Matt Hancock for? How many
96.5 million.
96.5 million.
196.
190, nearly 200 million. Yeah. So serious money now, isn't it?
Yeah, it's serious money.
Most of it's going to Calderdale. Not that we're bitter.
Yeah, and that's why the reason we had the webinar is, we've got this real opportunity now to make our, plans as good and as sustainable and successful as possible. So, and I think I've learned a lot today, and that's why I think the next webinar will keep this team together, get some new other exciting and innovative ideas. I don't think it's going to be hard to be better than the contributions we've made today. You've been magnificent. So you've really helped us on our journey. Mike, I think that we should thank all of them. They're wonderful.
Well, thanks to everybody for taking part, and particularly our three major contributors, and for everybody else. There's huge changes afoot. There's huge things to do, a lot of work to do, and we want to work together. And I'll pass over to Barry for final comments.
I've said enough, Mike. I will say that there should be a panel. The leader of the council was on the call and has just said how much he's enjoyed it. We've had a lot of good participation. This will be now shared because we recorded it with many more people. We'll get their reactions to it. And then we'll, this is the beginning of this journey. And we're in a hurry to make to influence the spending of that 200 million. So we're serious. So I can't say enough thanks to the people that helped us today. We owe you, and in future we'll look after you, I promise. Thank you.
Very much.
Drink champagne on the terrace of the House of Commons when we're able to do.